3rd week of pregnancy. Can you believe that now, yes, you are officially pregnant? Welcome to Pregnancy Week by Week, the original here from the Parenting Almanac. And if you want to know everything that's happening to you right now as well with your baby, stay with me, then I'll tell you. Hello, I'm Monica Romero, creator of Gestação Semana a Semana on YouTube Brazil. I'm very happy to have you here with me. And now, yes, officially pregnant. What a delight. Now you have a baby. I explained in the 1st and 2nd videos that we start counting gestations by the date of the last menstruation, which is when our body begins to prepare for the new cycle so that we can generate a life and generate a life for women. It's not just providing the egg, we have to. Getting this baby inside of us, by thus having a much greater influence of hormones. I also explained how fertilization happened. In short, in an ejaculation between 100 and 3,000 sperm are released. About 200 will reach the egg and only one can fertilize. What about the time he fertilized? Your baby's entire genetic load is set, run by eye, race by skin, hair color, sex of the baby, everything is defined. And there is no way to change that. It's already fixed there. Unless you're fraternal twins, that is, you ovulate more than one egg has been fertilized with different sperm, which is 1 per egg. In this case, each baby will have its own genetic load. It can be a boy and a girl, one light hair, another darker hair. It can be all of this or not after fertilization has happened, which happens here in the fallopian tube. When this fertilization happened, here begins a cellular multiplication on the journey that the egg, which became a zygote, right, that it has already been fertilized. Now it already has a partner there. Let's call it a zygote. The zygote begins to multiply. And when he gets here, he's already turned into a blastocyst of so much conglomerate of cells that he already has to implant. And during this trip, he separated a little piece, left, and this little piece continues to multiply. Then you will have an identical genius with univitelline genius. And that genius will have the same genetic load, except personality. Personality is not inherited. So are the environmental or even gestational factors that will make you develop all part of your baby's personality. I lost more. I'm in love with this world. As soon as this journey passes, which happens between 5 and 7 days, this journey of the egg that was fertilized became a zygote, became a morla, became a blastocyst. It will arrive here at the wall of the uterus, and here will begin our famous implantation and the implantation of this fertilized egg in the wall of the endometrium, which is a coating that we have inside the uterus. When this implantation begins, I usually say that it is like 11 little plants that it needs to establish in fertile land. But for her to be able to do that, the earth has to be really thick. If it is not thick, there is no place for the root to enter. So, the endometrium needs to be thick. Who will contribute to this is our progesterone, okay? Our progesterone that is thickening the endometrium there, and by the way, is one of the cases of loss, right? Baby in the first few weeks. This is when the woman is not producing progesterone properly. If you have already experienced a loss, talk to your doctor even without knowing if you are pregnant or not, that he will be able to help you in this process, okay? So that you don't lose your baby. It's super easy. The intravaginal solves a lot of problems, okay? And when this implantation begins, some little vessel there can rupture. And when the vessel ruptures, a discrete bleeding can occur that can last from 1 to 3 days, the famous bleeding of meditation. Then you tell me, Monica, I didn't have meditation because I didn't have bleeding. What if I told you that out of every 10 women, only 3 will experience this bleeding? It's not everyone. All seasons have to go through nesting, but nesting bleeding is not good. It is every 3 out of 10 women. So don't worry if you didn't have this bleeding. But if you did, you are already discovering that you are pregnant. You are not discovering it, or you will confuse it with menstruation and discover the pregnancy ahead. This bleeding may also happen. It can vary greatly in color. Why? The bleeding happened there, and he's going to have to come down, right, up to our entire uterine cavity, then our entire vaginal canal, so it can come out. If when it arrives in the uterine cavity, there is still a lot of mucus, it can dilute in this mucus and become a little pink. If it broke and it's already gone fast, It may be red because it hasn't diluted yet. And he also didn't darken blood in the clot, but he took a while to come out because he had little mucus. He can come out like coffee grounds, which is that more coagulated blood, so he can have several of these when dealing with bleeding. It's alternate colors just to confuse the head of my tempters. And if you try, I'll leave a linked playlist for you to help you also accelerate this process so we can have this positive soon to celebrate together. Now, if you're pregnant, stay here that it's time. I told you, aren't you officially pregnant? The time has not come to talk about the development of your baby, but before it, I still need to tell you that with nesting begins the release of HCGO, famous hormone of pregnancy. This hormone, that is the one that reacts in the blood test or the pharmacy test, which are super reliable, but it's still early for you to do it. See, the concentration is still very small. Despite the HCG tripling every 2 days, it's still too early for you to do it, okay? So hold off a little bit until next week, but you can already realize a little bit of what is happening in your body. And that basic distrust at the end of this week, maybe you can already do it, okay? More or less after ovulation, we count 13 days to take the test, but there are already some from the pharmacy who are super confident. But they're expensive, okay? Which you can perform before the menstrual delay and find out if you already have a baby or not. Remembering that if it is negative and symptoms continue after 4 days, redo the test 5 days. Maybe when you did, you had little concentration of HCG to react on the tape, and after that you can do a blood test. There are 2 types, beta-beta HCG quantitative, that will show what is the concentration of the hormone in your body, and qualitative, that you will talk if you have it or if you do not have it, if it is reactive, not reactive, or positive or negative. If you have to do it quantitatively, and it shows you much more information. Okay, what are you gonna do? It's already complete, right? Easier. And when you get that HCG production, you're going to have that concentration later on. However, the denial does not end there. It's not good. The denial will last more or less about 2 weeks, which is implantation. But it is already having as its production, there is micro-amniotic baby development. Baby development. Let's talk about the puppy then. Your little puppy already exists. Officially, the pinhead, most beautiful, hot, cuddly in the world. Your blastocyst, that's already implanted. It's already a very tiny baby, but it's already there. It has the head of a pin and it has approximately 0.15 millimeters. It's pretty thick. He's going to feed now, right? So he can grow from the nutrients he has, both in his hydrometer and in his fallopian tubes. And it's with all this multiplication. Your baby's accelerated cell phone will start to gain size and weight very quickly. So we have to be very careful at this time with all the chemicals we can have access to. And I'm not just talking about drugs, alcohol, tobacco. I'm talking about chemicals for hair. I'm talking about creams, anti-wrinkle, anti-age, anti-acne mainly. Many of them have chemicals that in this crucial, important part of your baby's development, it's very important that you stay away from them. For example, some obstetricians will allow you to dye your hair again in 3 months, others only when your pregnancy is over. To do this, you will always need to take a photo of the product you are going to use and take it to him so he can see what the chemical composition is to see if it can bring any risk to your baby. It is also at this beginning that the baby's neural tube, the baby's brain, forms. So it's important that you're taking your folic acid or your maternal vitamin or your ferrous sulfate or all together since that passed. By your obstetrician, okay, everyone who's tempted already has to take a folic acid. Don't be desperate if you just found out, okay? If you have not prepared folic acid today, it is artificially put in flours. So if you eat bread, eat a cake, then you are getting a considerable amount, let's say so that you do not have this problem in the development of your baby. Do you already know this information that is very important in your baby's development? It is a crucial moment, and that is a crucial moment. We've already talked about your diet too. Your diet is also very important for your baby. So start avoiding the packages we open to start with those we peel. Start prioritizing healthier foods. Everything you eat goes to your baby too. So start prioritizing already. Don't forget to also start increasing the amount of liquid. Don't you drink a lot of water? 2 liters of water a day, please. It is important to pay attention to your food, the quality of your food. It will influence not only your pregnancy, but also the feeding of your baby. Because in a little while, he's going to start swallowing the amniotic fluid and he's going to start feeling some flavors of what you eat. So it is important that he has all this experience. Where is the menu, if possible? Talk to a nutritionist or your obstetrician. Ask for food tips, and how also indicates, let's go for tips of the week. We have tips of the week, yes. The first tip is, do you do physical activity? If you do it, cool. But if there is any risk that you are pregnant, even if you do not have confirmation, talk to your gym staff or with your instructor for it. Know that you are attentive or that you are pregnant, so he can readjust your workouts. It doesn't mean that you won't be able to do them anymore. But at this beginning, it may take a little bit of whatever it is. It's an exercise with a lot of impact or a lot of strength. Okay? Those who have never done physical activity should start doing marathons now. Don't worry. If you don't do physical activity, start with walking, light walking. You will gradually increase the time. Okay? When we are pregnant, we become healthy overnight. It had a construction, and as all this is new to your body, you can't tire out, you can't tire your body, so physical activity is important. If you already do it, continue. You just have to maybe adapt something, but if you don't do it, start in a moderate way, okay? For God's sake, you don't want to solve 10 years in 10 days. That's not how it works. And during pregnancy, we have to take special care. And finally, a new habit for your life whenever you go for an exam or going to the dentist is very important, okay? There are some types of gingivitis, inflammation of the gums, which can even cause part of the premature baby. So it is important to take care of your oral health. Whenever you go to the dentist or perform an exam or any doctor, let them know that you're pregnant. Some medications may not be applied, some tests will have to take some special care, and some procedures will have to be changed, all for the safety of you and your baby. You're very welcome. I was pregnant week by week. I'm very happy to have you here with me. There's more news going on. I can't wait to catch up with you every week. It is an honor for me to be able to participate in such a special moment of your life in which I stay with you. See you in the next video.